Today is Sunday, May 17th, 2020, and this is Flashpoint. Hi, welcome to Flashpoint. For the last 2 weeks, we have been focusing on the tricky high-wire act of emerging from the lockdowns and stay-home routines we've been enduring, and we remain at that intersection this morning. In fact, all of us are pretty much going to take up residence in that uncomfortable space for the foreseeable future. I can remember more than a month ago wondering, what would life look like on the other side of the curve? Today, I am still wondering. Different states are trying different approaches, and some will be tempted to copy their success or run from their mistakes, but that leaves us wondering if one size fits all, or will each state have a singular experience with reopening just as they have had with the disease itself. This morning, we're going to dig into a couple of the trickier turns to navigate. A little later, we're going to be joined by several small business owners. How eager are they to get back open? And what will they do to create retail spaces that customers will be eager to frequent? Are we moving too slowly or too quickly for them? But up first, you've heard a lot about contact tracing being a critical ingredient of moving forward. What is it? And what does it look like if you're a part of the tracing process? Is it the key to getting Michigan open? It's today on Flashpoint. Well, testing, testing, testing. It has been the mantra for so many since the coronavirus first appeared. It gets complicated. I want to start this morning with the idea of contact tracing, which will be the next step if we can get enough testing. Josh Petrie is in the epidemiology department at the University of Michigan, and he is a contact tracing specialist. Josh, really appreciate your time today. I want to start with where you think we are on the testing conundrum. We have all been saying since the beginning, we got to be able to test, we got to be able to test. And yet, we've also come to realize that a test is really only as good as the moment that you take it. And then everybody almost needs to be tested every day, don't they? Where are we on testing, do you think, and our understanding of it?
So our ability to test has really improved over time. We're not quite to the point where we want to be, but it's definitely improved. We've gone from where only people who are hospitalized and those at highest risk are being tested. Now we're getting to the point, at least in some areas, where if you have any symptoms, you'll be tested. That's not the case in every area of Michigan, and I know the state of Michigan is working towards that and having the ability to test more and more people.
With what that moves us into, then once we've got an understanding of where the tests are popping up positive, and then we can start moving into what you specialize in, which is contact tracing. Explain to me what contact tracing is and how you see it working in a pandemic.
Yeah, so contact tracing is really public health detective work, where once you have identified a positive case through testing, you are making contact with them, interviewing them to see who they've had close contact with and the couple days before they got sick up until when you've identified them and they start staying home. So then you'll want to follow up with all of those close contacts to give them information on how they can best prevent spread to others, quarantine at home, and then make sure that they're letting public health officials know if they develop symptoms themselves.
Couple of things here then, because the scenario that you're describing makes a lot of people uncomfortable. There's a big brother aspect to sort of drilling down into somebody's life and all the contacts they make. Are those kind of worries legitimate for people?
I don't know. I think that the public health officials do the best they can to maintain privacy. So when they do make contact with the contacts of a sick individual, they don't reveal who they were contacted, who had the illness. So there is a real effort to maintain privacy. And the goal really is to reduce additional infections. It's not like these data aren't used for other purposes. It's really only to prevent spread of infection.
It can be tough sometimes, I guess, to convince people that there's only benevolence in the data. But I'm curious, as somebody who has studied this and made this your life's work, now that we reach a stage of public health crisis that none of us have really ever seen before. The detective work that you mentioned earlier, is it harder when it's this vast, or is it easier when there's so much of it around?
No, our ability to contact trace definitely gets harder the more cases that are out there, and it also is harder when there's people are making more contacts, more close contacts. So towards the peak of the coronavirus activity in Michigan, it would have been nearly impossible to trace all contacts. So what we're going to be looking for as cases continue to decrease, we start opening back up more, it's going to be critical that we maintain low levels of cases through contact tracing.
When somebody is asymptomatic and yet is a carrier, which we know is a key problem with this thing, does that change the way that you want to trace them, or are they all the more important for you to trace and follow?
Yeah, so there's some key distinctions with asymptomatics. There's a certain proportion that are truly asymptomatic, and then there's some people who can spread the virus before they become symptomatic, so they're pre-symptomatic. And contact tracing definitely is going to look at those people who are pre-symptomatic. They'll look at contacts that they had before they got sick. Finding true asymptomatics, especially without really widespread testing where you could test all contacts, is a lot more difficult.
But to talk a little bit then about the difference between the people who are being tested for having the disease and the antibody test, the people who test positive for having had it. How do you delineate the way that those folks are traced, and is one more critical to you than the other?
Yeah, so the way I would imagine it's happening is going to be primarily based off of the molecular testing to see if you're actively infected with the virus, not necessarily the antibody test. There's a lot of antibody tests that have been developed, but there's been less work to date on actually validating how well all of these tests work. You know that the Food and Drug Administration has started to crack down on some of these tests. But bottom line is we still don't have great standardized antibody testing right now, and we still don't exactly know how well all these tests work and what it actually means when we find antibodies. So what contact tracing will be based on is testing for if you're actively infected with the virus.
Lastly then, Josh, what I want to ask is if you feel like the way that we all seem to be understanding where we are, whether it feels accurate to you. We wonder if whether the death toll has been undercounted. Some people wonder if it's been overcounted. And given the lack, or the relative lack still of mass testing, do you think we have a great handle on what we're dealing with? Or are we still kind of in the dark?
I still think we are underestimating cases to some degree, especially more early on in the epidemic. We weren't testing more mild cases, and we certainly have seen, I haven't seen Michigan data specifically, but we've seen in other areas where the number of deaths over the past couple of months have been much higher than the number of deaths in previous years, even without confirmed testing. So yeah, we're definitely probably underestimating cases and deaths at this point still.
If we're underestimating the number of cases, though, that's got to be some good news, isn't it? If it's a vastly undercounted, because it would mean that the mortality rate is lower than we expect.
Yeah, the mortality rate probably is lower than if you just take the number of deaths that are reported divided by the number of cases. But even with the additional cases we expect might be out there, it's still quite a bit more serious than other respiratory viruses like influenza.
Well, your work feels like a really critical step in getting Michigan or any place else for that matter moving forward. I really appreciate you spending time with us this morning, and good luck and stay safe, Josh. Thanks very much.
Thanks, you too.
You bet. When we come back, we'll talk with some retailers. How eager are they to get the open sign turned on again? This is Flashpoint on Local 4.
Right now, knowing that you can lean on your friends and neighbors is more essential than ever. So at Gardner White, we want you to know we've got you covered. Introducing Gardner White's 3-month payment assistance plan. Take advantage of 60 months interest-free, and your first 3 payments are on us. That's on top of money-saving Memorial Sale price cuts and free same-day delivery on everything.
We make it easy for you to transform your home.
Shop Gardner White today and save on the furniture your family will love.
We stayed home. We stayed apart. But most importantly, we just stayed. And our Suburban Collection family of 3,500 team members strong has had the honor of serving this community for the last 70 years. And now it's time to get back to work. Our service bays are open, and we are live online to navigate purchasing from home. Because we're the Suburban Collection, and we are here for you. Today, tomorrow, always.
The stories that really keep me going are the ones that showcase the best of who we are as Detroiters. So many of you reached out to us asking how you can help.
Because of your generous donations, our Food for Frontline project has served 20,000 meals to workers helping to save lives. We want to thank you and our restaurant partners, but we still need your help.
You can donate now at clickondetroit.com/frontline and stay with Local 4 for the moments that matter.
Welcome back. As we look ahead to loosened restrictions on retail outlets, what can be done to maximize safety so that customers feel confident and thus businesses can stay afloat? Joining me to talk about it are the proprietors of 3 small Michigan businesses. Bill Golden, up there in the upper left-hand corner, owns Golden Shoes up in Traverse City. Janet Webster-Jones, to the right there, owns Source Booksellers in Midtown Detroit. And Rachel Lutz of the Detroit boutiques, the Peacock Room, Frida and Yama. And she appeared with the governor at her briefing this past week. Bill, if we could, I want to start with you because we don't hear enough from outstate. And I'm really, really curious as to, from Traverse City, as you look at the way that the whole state has responded, and Traverse City obviously hasn't had near as many cases as we've seen in Southeast Michigan. Do you feel connected to what you're watching in the rest of the state and the orders that are going out, or do you feel like it's another world?
No, I mean, you feel connected because it's not just the state, it's everywhere. So,
yeah,
you get that connection through there. The cases that we've had in Traverse City, Grand Traverse County is 23 cases and 6 deaths. All of them are tragic. You don't want any of that, but we don't have the thousands and thousands like, in Southeast Michigan, and Kent County is, I know it's been hit very hard lately too. And the surrounding area around, with Antrim, Grand Traverse, and Leelanau and Benzie, I don't even think we've had 50 cases.
Yeah. Different. Well, then let me start with the question for all of you to answer that I'm really curious about. And I'm wondering how eager each of you are to get your doors open again, in a hurry to do. Could you do it tomorrow if you could, or is it more of a wait and see approach? And Janet, let me start with you.
Well, we're really not eager. We've had 3 different incarnations of our bookstore, and this is the 4th one. It's called online sales. So we've turned the store almost into a warehouse now. And we've been doing online sales ever since the shutdown began. And I have to just comment too that this is a world pandemic.
Sure.
And everybody in the world is experiencing this, regardless of who you are or where you are. So I like to say that we're all at zero and a start over time again. It's an opportunity to start over and to begin anew. But we are going to open gradually, and we're going to do it slowly. We're going to do it softly. And my idea is to do it as kindly as we can to our customers, because I do not want a feeling of fear or if you touch anything, something's going to happen to you, or guardedness. I want to create in that a community spirit, which we have tried to maintain throughout the years we've been here in Midtown Detroit, this is our 18th year. And so that's my approach. Now, how we'll do it, we'll take the precautions that we've been asked to do. We'll have sanitizing materials. We'll have, I've decided we'll have lovely cotton gloves for some people. I'm going to have a bit of a soft opening for people who have been extremely generous to the store from the very beginning of the shuttered doors.
Yeah. And
they're going to have an invited time to browse in the individually the weekend of May. And then somewhere in June, we're going to have some more soft openings where we'll have invitations, but we're not going to fling open the doors and say, everybody come on in right now.
I'm hearing a yellow light from you. Let me move to let me move to Rachel. Rachel,
do it all.
Yeah. Rachel, same question then. Where would you put your level of eagerness at getting back? And by the way, I should also mention you've had a bit of success moving things online as well. But where are you on your eagerness to get the doors back open?
So I'm very eager to get back to business. I'm not so eager to reopen to the public just yet, and I think that those can be two very different things. Every retail store is different. We are in different neighborhoods. We have different demographics, different types of merchandise. But we're really, like my store at the Peacock Room, our first and foremost priority is safety. So when I feel that it is safe to reopen our doors to the public, and I feel confident in the steps that we're going to be taking to mitigate those risks, that's when I will reopen. Even if the governor said tomorrow we could reopen all of retail in Michigan, that doesn't necessarily mean that every store is ready to reopen, or that frankly we want to reopen to the public just yet. As Janet was starting to say, this is not just an opportunity, it's a forced opportunity. So this is really, this has been very financially devastating for me. I don't really have a safety net. I have not gotten my PPP dollars. It's really, this is dire financially, but I need a neighborhood to come back to. I need customers to come back to, and I need employees to feel safe coming back and interacting with the public. And until I get those things, I'm not prepared to reopen my doors to the public.
Yeah. Bill, I'm curious, if you could open tomorrow, would you?
Yes, I am ready. Last week I had the carpet cleaners in. They cleaned the carpets. They did all the furniture, the cushioning. I have the sanitizers, gloves, masks for everybody. So I could open tomorrow. I would limit the number of people in, but I could open tomorrow. I'm wondering whether or not you've had any success online. I know lots and lots of people buy shoes online nowadays. I don't love it. I want to be able to try on a pair of shoes. Have you been able to move much business online, Bill? I do have a website. We don't sell online, but all my product is on there, and people have been emailing me and calling, and we're doing curbside, we're doing deliveries, shipping, and I was doing it myself. Wednesday, I was so overwhelmed with it, I couldn't answer the phone and do the curbside. My daughter was making my deliveries for me. So starting yesterday, I bring in 2 people a day now to help me from 11 to 3. I come in earlier than that and get the emails, and if there's any messages, I go through that first, and then they come in at 11 o'clock. And, so we've been advertising 11 to 3 for curbside pickup. Any questions you have, we're there to answer the phone. And like I said, a lot of emails and a lot of text messages.
Yeah.
I had my phone number put right out there. So if somebody needed something, they could text me.
I'm curious as to whether all of you are going to expect or desire that your customers who come in be wearing masks. Janet, do you want everybody in a mask, or will you let them decide?
I would like people to be conscious of that and to wear masks. If they don't, we'll have some paper masks here available for them, along with the gloves. We have the issue of books and people handling books.
Yeah. So
we'll, when we get to the place where people that we have not invited directly to come in, we're going to have places where people can put if they take a book off the shelf, they're going to put it down on a table, and we'll wipe it down, whatever we have to do after that. So yes, we are certainly going to treat this seriously, and we want people to have masks on, and we want them to have gloves on. So we will provide some gloves for them as well.
Rachel, we know there are some retailers who are really bristling at the idea of either demanding masks of the customers or of the sales associates. Where do you come in on the masks?
I don't like to use the word demanding, but no mask, no service within my doors once we do reopen to the public. If someone does not feel comfortable wearing a mask, I completely understand. I'm happy to help them curbside. We've been helping customers virtually. We can offer that to them as well. We have, as we call them, fairies that will, do a virtual shopping appointment with you. You tell us what you want. We'll FaceTime with you in the store. So yes, no mask, no service within our doors. We're still happy to serve. I think it's important for retailers to also understand a lot of us are feeling bullied or threatened by these few incidents of violence. And I think if you put it in perspective, millions of store visits in Michigan in the last several months, and there were a couple really tragic incidents of violence. I'm not intimidated by them. I will still be asking my customers to wear masks when they're in the store.
Bill, how about you?
I think most people now are comfortable wearing the mask. We will start out with everybody wearing the mask. Like right now, when we do curbside, we do go out with the mask, and so and I do have extras. I bought boxes of them, and so I think everybody's feeling pretty comfortable doing that now. Come July, when we get a lot more tourists, we'll have to see. But I think for starting out, we're definitely the mask. All my sales help knows that too.
Bill, in a tourist city, I'm curious as to what your expectations are of that summer crowd that generally is always a big part, I'm sure, of your business. We've seen the Cherry Festival canceled for this year. What are your worries about tourism season?
Well, I think that there's a lot of pent-up demand, so I believe people will be traveling by car. So I think we're really going to see that again. The airlines, people aren't going to be doing that, but I think the Ohio, Chicago, St. Louis, we're going to continue to get that business. And for the downtown, what has been proposed is the 100 and 200 block, or the main 2 blocks, is blocking those off. So there'll be no car traffic. So you'll be able to move around more. Restaurants can bring out tables now because they're going to be down to 25% probably. So we're still going to be able to serve all those tourists.
Janet, Source is not a massive, not tons and tons of square feet. How do you expect that you'll have to sort of arrange customers and make sure that everybody is behaving in a mannered and respectful way of the other customers?
Yes, well, we are under 900 square feet, so we don't have many feet to use for six feet separation.
Yeah.
And I'm thinking that we'll have small numbers coming in. We're not going to just have masses in anyway, and maybe we can control that somewhat by people having an appointment perhaps, or you calling and taking the number. I'm not altogether sure as to how that will go, but I know we do have to limit the number of people that are inside at any one time. And I'm glad we heard about Traverse City and their tourists. We have a lot of people coming in here, and I think Rachel does too, from other places as a destination as they come. If they decide to travel, frequently they look for a bookstore. And because it's a kind of a neutral place and a welcoming place, and it helps like that. So hopefully we will have a few of those people, but we're going to have to limit when they come. I am thinking about having open doors part of the week and the other part of the week doing our online sales. I don't quite know yet because every day things get revealed as to what's best. So we have to wait and see what the store asks and what the people wish. So
I've just got a couple of seconds left here, Rachel. We'll let you have the last word on, do you expect to get pretty explicit guidelines from the governor and from the state, or do you feel like you're kind of left on your own here to figure it out?
I'm primarily following the CDC guidelines, which I hope the governor is as well. So I'm looking first to the CDC and the medical community's guidelines. Then I, as a retailer, will look at what the state is telling me, what I am and am not allowed to do. And then I'll decide within my own judgment, honestly. This is very dangerous. There are creative ways that we can start selling. We've been doing these amazingly successful Facebook Lives. I'm actually doing a virtual book party with Janet in a week, and we're doing it outdoors on her sidewalk, so that I don't even have to be in the store. So this is a great time for retailers to start getting creative. And I really appreciate all of the thoughtfulness that you all have put into this. Thank you so much for being here, and best of luck moving forward. Appreciate the conversation. We'll wrap it up for Flashpoint right after this.
Facts have never been more important than now. They can mean the difference between life and death. Rely on the Trust Index, your first line of defense against disinformation. Just look for the seal. It's true means it passed the test and we can back it up. Not true means it's fake. Don't trust it. And be careful means it's not entirely right or wrong, but could be risky. In the battle against disinformation, no fact is off the table. If it seems suspicious, send it to us and we'll get answers. The Trust Index, only on Local 4 and Click on Detroit.
Beaumont doctors and caregivers continue to lead the way through the COVID-19 crisis, and we are dedicated to keeping you safe in our care. We're taking extra steps to protect the health and safety of all our patients and caregivers so you can feel confident coming to Beaumont. Come to us in an emergency. Talk to your doctor to begin scheduling necessary screenings and procedures. Our expert Beaumont doctors and caregivers are here to help you.
We stayed home. We stayed apart. But most importantly, we just stayed. And our Suburban Collection family of 3,500 team members strong has had the honor of serving this community for the last 70 years. And now it's time to get back to work. Our service bays are open, and we are live online to navigate purchasing from home. Because we're the Suburban Collection, and we are here for you. Today, tomorrow, always.
People talk to me about Frank McGeorge all the time, where misinformation spreads all around the world like wildfire. Frank just has this really measured approach to some very complicated things. Well, Frank is an emergency room doctor.
I am seeing firsthand what's really going on.
His producer, Sarah Mayberry, has a master's degree in public health. We are really, really fortunate. Frank is always there for us, and right now he's always there for you. I so appreciate the three business owners who talked to us in the last segment. You know, they're all toughing it out as best they can. We've put their websites on clickondetroit.com on the Flashpoint page if you'd like to frequent their businesses online. That's it for us. Have a great week. We'll see you next time on Flashpoint.